I'm Dr. Ravi Garg. I'm a plastic surgeon with specialty expertise in cranio-maxillofacial surgery, as well as head and neck microvascular surgery. So in my practice, I treat a variety of conditions related to the craniofacial skeleton and the head and neck. This includes tumors and cancers of the head and neck, obstructive sleep apnea, nasal obstruction, jaw deformities, and congenital and craniofacial conditions. I'm part of a multi-specialty cancer team focusing on patients with head and neck cancer. As a microvascular head and neck surgeon, I use vascularized tissue transplants to rebuild the jaw bones, the oral cavity, the oropharynx, the skull base, to reconstruct the defects that arise from cancer removal. What this does ultimately is to help restore important functions to a patient: speech, swallowing, chewing, breathing, smiling, all of the functions that relate to the head and neck and to a cancer diagnosis. So at Scripps, taking care of patients with complex medical conditions means collaborating with a variety of specialists. This includes neurosurgery, otolaryngology, colleagues in plastic and reconstructive surgery, as well as physical therapy, speech therapy, nutrition, occupational therapy, and our entire head and neck cancer navigation team. We have the ability to offer patients a jaw-in-a-day reconstruction in which we remove a tumor from the jaw bones, rebuild the jaw structure immediately, which includes placement of dental implants and delivery of a temporary denture, so that a patient goes from having the tumor removed to rebuilding the entire jaw bone structure and teeth in a single day. This is a collaboration that involves, surgery, reconstructive surgery, as well as maxillofacial prosthodontics. When a patient comes to see me in the clinic, what they can expect is that we're going to really try to understand what their concerns are and what their goals are, and then to take a complex problem and break it down into something that's more accessible and tangible to them, so that they feel really confident in their understanding of both the problem and the potential treatment options. I chose this specialty area because I love the impact that we can have on so many aspects of patients' lives. When we're talking about the craniofacial skeleton and the head and neck, there's a lot at stake regarding chewing, breathing, speaking, swallowing, everyday functions that we take for granted but that are so vital to an individual. So being able to understand the complexity behind those functions, the anatomy of the head and neck, and have an array of surgical skill sets that I can apply to help restore, improve the form and function of this area is extremely rewarding.